Well, I'm very excited to talk to our guest here today. And we have Maddie Kahan. So, Maddie, why don't you begin by letting us know a little bit more about you?
Definitely. So I'm a current pediatric epilepsy fellow at Children's Hospital Los Angeles. And before then, I was a child neurology fellow at UCSF, where I started getting involved in transitions work. And during my 4th and 5th year as a child neurology fellow, we looked at ways in our epilepsy department that we could facilitate the transitions process and make it smoother, particularly for our complex epilepsy patients.
And I actually would love you to expand that a little bit more because I was curious why you developed the interest. What obstacles did you run into that sort of pointed you in that direction?
Yeah, so I think since my early time in child neurology, I noticed that there was a great need and a huge gap in the services that our teenage patients were getting as they aged out of pediatric care. And particularly, this was the case for those with harder to control epilepsy. And I noticed not only were young adults hanging on, within the children's hospital system until, their early 20s or mid 20s even, but some of them were having, catastrophic outcomes of going into status because they were, in between providers or in between care. So this was an area that I knew had lots of room for improvement and an area that I knew I wanted to work on.
Well, you did some very remarkable things that were recognized, one of which was outreach, which we'll talk about in a minute. But the other one is you developed surveys, you developed toolkits. Can you tell us a little bit more about those things?
Yeah, so we did a couple different interventions at UCSF to help improve transitions. The first of those things was a toolkit in our electronic medical record. We use Epic, but things like this can be done in multiple different EHR systems. We created a toolkit that was started at age 12 and would follow the patient up until they were ready to actually transition. So the toolkit was mainly designed to be a living document and update at every single visit with the patient and family there. So not only would it pull in things like what workup was done to date, but then it would also elicit the concerns of the family and the patient themselves. So that way, by the time they were ready to transition, you would have this packet that could then be used to hand off to the adult neurologist or adult provider.
You did mention a survey as well. Can you tell me a little bit more about that?
Yeah, so the second part of our project was we surveyed specifically adolescents and their families with difficult to control epilepsy and more refractory patients. That included patients with Lennox-Gastaut syndrome, patients on the ketogenic diet, patients who were post-surgical, and certain genetic epilepsies that were associated with intractability. Because we know that these are the populations that not only is it more difficult for them to get adequate adult neurology care with a provider who feels comfortable, but it's also just more difficult for them to obtain care in general. So we surveyed 116 families about how they felt with the transitions process to assess, how comfortable and how ready they were. And we started also at age 12. And what we found was that specifically families of patients with Lennox-Gastaut syndrome felt significantly less comfortable, particularly with managing seizure emergencies. And that was the same also for our families of patients who did not speak English as their first language. So we identified both of those populations, LGS and non-English speaking families, as areas that we really needed to have more intervention on, and families that we really needed to provide more support to.
Very interesting. I'm going to jump back for a moment because I'm curious about one thing about your toolkit. And that has to do with how about your colleagues and the other people that were involved? Did you involve all those around you, and how was it accepted as a tool by your regular practitioners or other neurologists?
Yeah, that's a great question. So this was an intervention that we implemented among the entire epilepsy department. So that consisted of 5 epileptologists and several nurse practitioners as well. It was definitely a little bit of convincing to get the uptake at first, since you can imagine, as a clinician, you're really busy during each visit, and to have to do more clicks and do more things in a note is definitely time consuming. But the way we designed the toolkit was such that several parts would auto-populate: their MRI, their EEG, and what medications they've tried. So as much as could have been auto-populated was auto-populated. And that made it a lot easier in terms of uptake. And we found that once all that became automated, it was a lot easier for people to adopt.
Okay. And sort of following that down the line, because I'm very interested obviously in transition as well, what lessons have you learned? What practical things can you tell those who have not taken it as far as you have?
Yeah, I would definitely say as early as possible to start the conversation, the better. That's one thing that we know improves outcomes, and one thing that we know also reduces anxiety among caregivers. If you frame it as, this is not something that's happening tomorrow, we just want to talk about it now to make you more comfortable. We're not kicking you out now. We found that the process goes a lot more smoothly. So that's definitely lesson number 1 that I've learned, is to start the process early. And then also I would say just being really mindful of more complex patients and more complex families that might have more needs, particularly children with developmental differences who might need more support with decision making. That was an area that we really leaned on our social workers and ancillary support for, to help with medical legal decisions like that. And that was something that families were really grateful for when we were able to connect them with people to help with the conservatorship process. So I would say that's a need that often gets overlooked as we're focusing so much on autonomy for our typically developing teens. So that was definitely another key take-home point.
Okay, well, that's excellent. Did you meet some resistance about starting so early? When we talk about starting with the toolbox that was developed by the Child Neurology Foundation, people came storming the podium. How in the world are you going to transition someone at the age of 12? And of course, the answer is you're not. You're doing what you're talking about. But did you meet some resistance with that?
I think overall, everyone shares the same goal, that we want to do what we can to get the process going. So I think on the clinician side, it wasn't that difficult, but certainly when you bring it up with families, and when we brought up the survey with families, I think that was a good opportunity to introduce what the transitions process was, because prior to doing the surveys, some of these families hadn't even realized that they had to eventually transition care. So I think it was a good opportunity for us to bring that up to families, as we should be doing early anyway.
One of the things that came up in your application was how you really did some outreach, but really to populations that have been identified as having difficulties, or populations that really don't have access. And you did that through some of the work you did. Could you expand that a little bit?
Yeah, definitely. So like I mentioned, we found that families of patients with more difficult to control epilepsy, and those whose young adults and teenagers don't have as much autonomy because they might have some degree of intellectual disability. That was a population that we found was really overlooked in the transition space. So that was a population that we specifically tried to include in our research, in our surveys. And one now, knowing going forward that they feel less confident in several aspects of the transitions process, we know now that this is a population that needs more support. Similarly, with our families who are on Medi-Cal and our families who are non-English speaking, these are also factors that are associated with lower confidence in the transitions process. So these are things that we hope to build on in the future in terms of targeted interventions for these groups, whether it's in the form of a support group, piggybacking on other epilepsy organizations, or whether it's just within institutions, having more dedicated support nurses and social workers calling these families more often to check in about how they're feeling and if they're ready.
Okay. Well, that's fascinating. There's so much more to this and a lot of depth. Is there something I should have asked you that I didn't?
Oh, we've talked about a lot. I would just say, And on the whole, I think this is still an area that is ripe with growth, and an area that still needs a lot of help, in a good way, because we as providers can support families going through this. We found in our survey that overall, the confidence among all of our families was pretty neutral in the transitions process. Overall, people felt about 50% confident that a new neurologist would understand their child's diagnosis when they transitioned care. So this is something that we have significant room for improvement on, and something that we can all do our part to improve going forward. So I would say just thinking about ways that you can leverage your own existing system, ways that you can leverage your EMR, ways that you can leverage your support staff in clinic, and the time that you do have in your clinic visit, as little as it may be, to help just little by little every visit get the family and get the child ready for transition.
Okay. Well, this was excellent. Thank you so much. And again, congratulations. We will get this wonderful little medal for your website because I think you deserve it. Thank you.
Thank you so much.